Hello everyone, and welcome back to our channel. In today's program, we will explore three main topics. 1. Showering with these signs greatly increases the risk of stroke, heart attack, particularly noteworthy. 2. Exercise at these 5 times easily results in stroke, damaging the entire route. 3. With these signs, it is highly likely that cancer is attacking, urgent need for examination. First up, showering with these signs greatly increases the risk of stroke, heart attack, particularly noteworthy. Ladies and gentlemen, showering is a daily activity essential to each of us. It not only helps eliminate bacteria and sweat from the body, but also allows us to observe any unusual signs. While showering, paying attention to these signs can help you detect underlying health issues. If you notice any of the following signs while showering, be cautious, as there may be an underlying health condition silently developing. Sign 1. Dizziness and discomfort. Developing good lifestyle habits in healthy individuals can help maintain stable blood sugar levels, unaffected by conditions like diabetes or low blood sugar. However, feeling dizzy or uncomfortable while showering may indicate unstable blood sugar levels. This situation could occur. Showering with hot water on an empty stomach can cause body temperature to rise and blood vessels to dilate, potentially leading to low blood sugar, cold sweats, nausea, dizziness, and discomfort. In such cases, it's best to stop showering as quickly as possible. At the same time, promptly adjust blood sugar levels and consume something to stabilize them, avoiding fainting, cardiac arrest, or even death. Sign 2. Body aches. If you experience body aches while showering, it could be a sign of cardiovascular disease. Typically, discomfort will manifest prominently in the heart, and sometimes this pain may also be related to other areas such as back pain, shoulder pain, toothache, and other symptoms. It's advisable to visit a hospital for a thorough checkup. More and more people are suffering from coronary artery disease, especially those with chronic conditions, compounded by various unhealthy habits. Sign 3. Abnormal bleeding. Specifically for women, noticing unusual discharge while showering requires careful attention. Under normal circumstances, vaginal discharge is clear or white like egg whites, odorless. However, if the discharge increases, changes color to yellow, green, or red, accompanies itching and a foul odor in the genital area, immediate examination is necessary. This could be a sign of gynecological issues. To prevent complications, it's important to visit a gynecologist as soon as possible for symptom-based treatment to minimize the impact of gynecological diseases. Timely treatment helps prevent adverse effects on reproductive health in particular and daily life in general. Sign 4. Itchy skin. Showering with hot water helps cleanse your skin, reducing itchiness caused by dirt and sweat. However, some individuals may experience uncomfortable itching, especially during scrubbing. This could be a warning sign of a dermatological condition. During hygiene, external stimuli can aggravate already sensitive skin, leading to itching. Through visual observation, red rashes and itching may appear on certain parts of the body. If this condition persists, early medical examination is recommended to diagnose and treat skin conditions accurately. Moving on to the next topic, 5 times when exercising increases the risk of stroke, causing harm in sufficient measure. Regular exercise is a healthy habit promoted for its detoxifying effects, fat reduction, muscle strengthening, and overall flexibility and fitness. However, exercising should adhere to specific guidelines regarding method and timing to ensure health safety. Exercising during restricted hours can pose significant health risks, especially increasing the likelihood of stroke and detrimental health effects. Here are 5 instances when exercise increases the risk of stroke. It's crucial to understand and schedule exercise times accordingly to avoid these periods. Time point 1. Exercising after drinking alcohol. Maintaining discipline in regular exercise is highly beneficial. However, it's best to avoid exercising after consuming alcohol, and ideally skip that workout session altogether. After drinking alcohol, the central nervous system's flexibility in the brain decreases, and red blood cells' oxygen transport capability also weakens. Exercising in this state reduces the flexibility of limbs, increases the risk of sports injuries, and oxygen deficiency. Furthermore, exercising after alcohol consumption can elevate pressure on the liver and heart, essentially offering no benefits and potentially posing life-threatening risks. Time point 2. Exercising after staying up late. Staying up late leaves the body feeling tired and less alert. Some may believe exercising at this time can improve alertness. However, it's a deadly mistake that we should avoid. After staying up late, cardiac muscle cells become fragile and immune function diminishes. Pushing your body through intense exercise during this period can lead to excessive fatigue, increasing the risk of sports injuries, catching colds, and even serious heart problems like stroke or heart attack. Time point 3. Exercising during the acute phase of illness. If you're unaware, the acute phase of illness marks the onset of chronic diseases, manifesting discomfort that impacts daily life and work. Exercising during this phase should also be avoided. Forcing the body to exercise adds strain and discomfort, potentially leading to severe outcomes, including death in extreme cases. It's advised for individuals with chronic illnesses to refrain from exercise or choose an appropriate intensity based on recovery status. Moreover, even with mild illnesses like colds and fever, it's best to avoid strenuous physical activity to prevent additional burden on the heart and lungs. Time point 4. Exercising after eating. Throughout the day, there are many ideal times for exercising, but immediately after meals is certainly not suitable for workouts. Exercising right after a meal, especially when full, puts additional strain on our heart and lungs. Exercising while the digestive system is actively processing food can lead to feelings of bloating, indigestion, and even nausea. Therefore, if you intend to exercise after eating, it's advisable not to eat excessively, and it's essential to rest for at least half an hour after a meal before starting your workout. Time point 5. Exercising before bedtime. Moving on to the next topic. 5 times when exercising increases the risk of stroke, causing harm in sufficient measure. However, this practice is not recommended. Exercising right before bedtime stimulates the sympathetic nervous system continuously, leading to prolonged insomnia. If exercising in the evening, it's best to choose an earlier time, around 6 to 8 p.m., rather than right before bedtime. If exercising in the evening, it's best to choose an earlier time, around 6 to 8 p.m., rather than right before bedtime. Dear viewers, among various types of cancer, esophageal cancer is quite common in Vietnam, yet its symptoms are often confused with other ailments, leading to delayed diagnoses. Consequently, most patients with esophageal cancer struggle to recover quickly or face challenging treatments. Take the case of Mr. Joden, for instance. Before his diagnosis, he often felt a sensation of throat obstruction but dismissed it as a sore throat, paying little attention. Each time he felt swallowing difficulties and throat pain, he self-medicated at home. Before seeking medical help, he experienced persistent, dull abdominal pain accompanied by worsening swallowing difficulties. Sharing with the doctor, he mentioned his regular alcohol consumption, no smoking history, and no family history of cancer. Upon examination and testing, doctors identified significant ulcerative damage in the esophagus, diagnosed as esophageal cancer. A gastroenterologist at the hospital emphasized that many cases are due to negligence towards seemingly simple symptoms like swallowing difficulty, only discovered when conditions worsen and cancer is diagnosed. The doctor advises that for early detection and effective treatment, regular annual checkups are crucial, even without symptoms of illness. When symptoms arise, it's important not to self-medicate, but to seek professional help to determine the cause. From there, early detection and appropriate treatment can be initiated. Additionally, to effectively prevent cancer in general and esophageal cancer in particular, the doctor recommends maintaining regular exercise appropriate for one's fitness level. Boosting immunity with a diverse, nutrient-rich diet rich in vegetables and fruits, abandoning unhealthy habits such as smoking, alcohol consumption, and late-night eating, and avoiding exposure to radiation and heavy metals known causes of respiratory diseases, especially lung cancer. When detecting unusual symptoms like prolonged swallowing difficulties, hoarseness, acid reflux, these could be warning signs of digestive tract disorders, including esophageal cancer. Other abnormalities like weight gain, weight loss, chest pain, headaches, and insomnia may indicate various other conditions. Severe headache, sudden onset of headache, which can cause nausea or vomiting. Signs of stroke appear and disappear very quickly. A person experiencing a stroke may have some of these signs. In addition, patients may experience transient ischemic attacks with symptoms similar to stroke, but lasting only a few minutes. Transient ischemic attacks are warning signs that a stroke is imminent, possibly within a few days or a month. Signs of stroke can come and go very quickly. Listen to your body. When you notice these signs, it's important to proactively see a doctor as soon as possible for evaluation. The golden hour for stroke is 60 minutes. Every minute that passes, the severity of nerve damage becomes more serious. We not only need to recognize symptoms such as facial drooping, sudden weakness on one side of the body, or difficulty speaking, but also act swiftly by calling emergency services immediately. Remember, time is of the essence. Every second and minute counts in minimizing brain damage and improving recovery chances. Share this information with family, friends, and the community so that everyone can be equipped with this crucial knowledge. Thank you for watching the video. Please hit like and subscribe to stay updated with more valuable information. See you in the next videos.